This is an MS Views and News interview with Susan Payrovi, MD, a patient and physician living with MS. She's founder of True Medicine, a wellness program designed to educate and inspire people living with MS to intentionally design and create their future health. Today, we're going to discuss being a patient leader and a creator for folks with MS. And we're going to get into all that right now. So now you're an MS doctor, but you're also an MS patient. I mean, like you didn't have enough on your plate, huh?
Well, none of us have a choice in this, right? And so I was a physician turned patient. And I always joke, I go, it's so good for a doctor to become a patient because it gives you so much perspective, right?
And insight and like all of that stuff
Yeah.
and how there's some sort of disparity between what's being taught in medical school, but also there's so much disparity between those. There's so much aligned between what the medical stuff is being taught to you and what you find on your own as a patient, as your own advocate, as your own leader. And you seem to have married those two and made a whole true medicine program. And like, that's fascinating. Like how, like you're helping people out here. Like, how's that been going?
I love it. It is
Mm.
just the thing that makes me wake up in the morning and I get excited about checking to see what's happened overnight and, how much progress we've made in the program and what the people in the program are saying. And because we have a lot of online forums, but, this isn't where I always started, and I wouldn't be here if it wasn't for MS. I used to be an anesthesiologist, had my first baby, got my MS, and then I couldn't practice anesthesia. So I had to figure out how to take care of myself. And I was also sort of unemployed because I couldn't safely practice anesthesia. So
Facts.
I ended up at an integrative medicine conference, learned what they were teaching, and it changed my life.
Right. So you're a doctor and a mom,
Oh,
and you're living your life like with their other guests on this program who are also medical doctors and had to completely redesign their life because living with multiple sclerosis changes your life. And as you work to get that back, uh, it might
yeah.
not look the same like you thought it was going to before you lost it. However, there's another purpose. There's a broader, there's more juice to it, and it means a lot more because you're serving people with MS.
Yeah. I mean, I love it. And I never thought I would end up here. When I first got diagnosed, it was so important that my neurologist said to me, you don't have to change your life. You keep doing the things you want to do, and we'll just keep pivoting as we need to.
Hmm.
And that's what I needed to hear, to have permission to say, oh, I can have more kids.
Right.
Oh, I can stay married. I can maybe still continue practicing medicine once I figure out where I'm going to go. I needed to hear from somebody that it was possible, that it wasn't going to be all doom and gloom. And so that's what I did. I had a good support team, and family and my husband have all been very pivotal in me being able to sort of reinvent what I do.
So True Medicine MS, like please unpack this. Like, what do you do with this program? And like, give me some not even success stories, but a common threads. Like, are there common threads that you hear coming into your practice?
Sure. So True Medicine is an online wellness program just for MS. Because I have to say, this is my favorite group to work with. Because I get it, right? It's the only group of people I can sit in front of and say, like, I know exactly what it feels like to be given the diagnosis, to be given medications and things that are sort of, confusing, right? And that I've gone through that process myself. So I wanted to make sure that people with MS had access to the information I share and practice with my patients at Stanford. So in my clinical practice at Stanford, I partner with patients. We work in groups. We talk about how to improve a chronic condition. Sometimes it's heart disease or cancer, and sometimes it's MS. I have all kinds of patients in that practice. And this is a practice where I'm seeing them as a physician, and over time, we make a lot of progress. But that scenario is only available to people who could see me at Stanford. And so there's everybody else who has MS, who's going online and trying to figure out the internet, which no layperson should have to do, because even when I was diagnosed, I didn't know the first thing about lifestyle habits that could help improve health. I had to go to conferences. I got board certifications in integrative medicine, functional medicine, Chinese medicine, acupuncture. Like, I had to build my new lens. And so what I'd want to do is to make it easy for people to access the information that's science-based, it's effective, it's safe, and it's going to work, because I've had the privilege of working with patients at Stanford, trying different things, trying supplements, trying new therapies, trying complementary therapies, teaching somebody, this is how you make a bedtime routine, or this is how you improve your diet. And I've learned there are things you say that work, and there are things that you say that don't work. So I am now hyper focused. Like, we don't have time to waste. Time is brain. Let's just hyper focus on the things that matter, and like, let's let go of the things that are a waste of time and money and effort. So I've put all of that in a program so people can just come in, get the information, but the most important part is the implementation. Because I always tell my patients and my participants at True Medicine, just coming to the meetings and just watching the videos doesn't do a thing.
Bro, things don't work unless you do. Okay.
That's right. So, and that's the hardest piece, because we're asking people to change lifelong habits. Like, what's harder than that? There's nothing harder than that.
There's no thing harder than that. And I think that's part of why I am successful, or I have some success in this way, because I have habits that are ingrained within me half of my lifetime ago. Yes. That I am accustomed to doing the thing, failing at the thing, and doing the thing and failing at the thing. Dozens, scores, four scores amount of times, and still showing up like it's the first, because I understand through the previous experiences in half of my life, I understand what it is to not be good at something, and then to be okay at something, and then to be pretty good at something, and then to be stellar at something, and how many goes and tries agains that actually takes, and how, when that applies to our health and our well-being and our relationships and how we just feel internally and our energy, it's tough to understand what that is until you have to do it for yourself.
Yeah. And it's a process. We're not born with perfect lifestyle habits. And, so much of what we get information from, like society, marketing, our families, our social circles, isn't information that necessarily serves our health. So I just kind of try to make it simple, one-stop shop. And here's what's, I think, really valuable. You can work on your own, right? And it could take a long time for you to develop a sleep habit or to do exercise regularly. But if you could do it within a framework where there's structure, and then there's a community of people that are like rooting for you, and you've told them your goals and they've told you their goals, and you're keeping an eye on each other, it goes so much faster. So I have a 12-week program where we do all the lifestyle habits. There's 5 of them: nutrition, sleep, exercise, stress management. The 5th one, the one nobody talks to us about. Do you know what it is? Toxins, toxin awareness, all of the man-made stuff we're getting, flooded with all day long. Like, what do you do with that, right? It's part of treating MS at the root cause. And everything I talk about in the program, and anything we do in integrative and functional medicine, is really directed at the root cause, right? Like, let's undo the bad stuff so that MS might be better. Maybe we can create a healing condition in our body, right? By providing a good, healthy cellular space for things to happen. So the common thread is people say, it's so much easier when I'm doing this with other people. I just needed to know the right information, because I can't tell what's the right diet for MS. I didn't know anything about toxins. I didn't even think that I never thought that it mattered,
Wow.
right? And so we just start putting the pieces together. It takes time. We do very small goals. Like I don't ever ask anybody to do anything that's big because I want them to succeed. And everybody picks their own goals. You know, working on nutrition,
Mm.
your goal could be, I'm going to eat one less cookie every day, or I'm going to eat 5 more vegetables every day, or whatever. Like you get to pick, but then you got to do it. We write goals, we talk to each other. So
Mm.
every week I meet with people, myself and our dear health coach, Dr. Roberta, who's incredible. And we have FaceTime on a Zoom meeting where people come in, everybody goes into breakout groups, talks about their goals, and people keep up with each other and root each other on. And so it's so beautiful. And, you know, I had no doubt that this formula would work because I know how it is at Stanford, but I think I do it in a much more robust way here because I have freedom in this program that's outside of my Stanford work, to build community in a way that's not possible in a medical practice. So no fault of Stanford, it's just different.
Yeah.
When I put people through the 12-week program, I have them score their symptoms at the beginning and they do it at the end. And over 12 weeks, the average drop in total global scores is 46, 47%. It's almost 50%.
Stop it.
And I haven't asked them to add on supplements. I'm not asking them
Right.
to like buy any gadgets. It's
Right.
just behavior. So this is a testament to the power of lifestyle medicine. And, you know, a lot of other doctors sort of aren't really on board with this. They think this is soft medicine. And
Mm.
I'm going to agree. It is soft medicine. It's gentle medicine, but it's medicine and it's powerful. It works every time. And by that, I don't mean I'm going to cure your MS, because if I could,
That's not
I
a
would have
thing.
cured my own,
She would cure her own MS. Okay.
right? But I guarantee people, I go, if you do this, you will get better. And
Absolutely.
by better, I mean less anxiety, less depression, less pain, less fatigue, more joy, more quality of life, better ability to engage with your loved ones, stay a little more independent.
Mm.
So
No,
that,
I think that's a part of it because people you just want to feel good now. You just want this thing gone now. And it's like, well, I get it. However, we've seen shifts come gradually, slowly, slash over time, and not even slowly, just over time. And when there's a space between, I need a result right now,
yeah,
and I know this is the right thing to do. And regardless of the length of time that it takes, I'm going to do this until my outcome shifts. Woo, there's a vast chasm between those sorts of thinking thoughts. And
yes,
your health is the bulk of that chasm. And I know what it is because I live it and do it. You know what it is because you live it and do it. And again, I'm a mess, man. Like there are a few days this week, I was not having a good day. Of
yeah,
like my last interview, I was not having a good day, but I know how to ride the waves and know how to tuck things in as much as they can get tucked in right now at this moment. And
mhm,
perhaps at another future moment, it'll be different and it'll be tucked in more in a way in which my previous self would think, oh, that's good. That's healing.
mhm.
That's something that I can say is different, as opposed to along the way, man, you're going to have a lot of shifts, but they might not be as perceptible as you think they want to be, or as you would hope that doing these sorts of things would give to you.
Yeah. I mean, it's a process, right? And some people are very impatient. Like they'll do something for 2 weeks and say, I'm not any better. And what I tell them is, look, you didn't get MS overnight. It,
Facts.
it may have felt to you like you got it over 2 weeks, 2 months, but it was probably brewing under the surface for years, if
Mm,
not decades. So
mm,
for us to improve a bad process that's been brewing for that long, Yeah, it's going to take time. That's reality. So I'm also really realistic. I tell people we're not curing, but we're going to try to get you into a better place where you feel like you're healing and you're improving and doing the things you want to do, but you got to do the work. And every day when we decide what we're eating, when we're going to bed, are we going to exercise today? Those are choices. So I'm all about the micro choices that over time add up to big, big shifts. So that's my message out there for anybody who doubts this. I just challenge you to try something small and see how it goes.
And over time as well, like the 2 week window, 14 days, that's wonderful. Great. Maybe to move the needle, you might need 16 days. You might need 23 days. It is unknown the amount of days that's necessary to move the needle. However, showing up with commitment and focus and dedication always moves the needle. It has not yet failed in ways that I've come to see.
Yeah, absolutely. So, I think we can do better in how we treat MS. I want people to do what they do with their neurologist because that is an important part of MS care. But don't forget about all the other stuff that we have data on that actually works. And if you put all those tools together, like it's impossible for you to not do better. And
I'm going to swap out your butt, doc, and say and. So
and
yes, you have your neuro, and that's like you. If you're the captain of the team, the neuro is the co-captain. Absolutely.
yeah.
However, there's so many other things that are part of that sentence, the and, that you can add and run those plays to see if you can move it along. It's not one or the other. It's
Yeah.
not this or that.
Absolutely. And these two types of therapies, your DMTs and your lifestyle therapies, they're not in competition with each other. They're actually complementary and
Mm.
they synergize together. So 1+1 is no longer 2. It's more than 2. And so isn't that what we all want, like for our future health, right? And so there is a path to get there. And I would be so excited for anybody who is interested in trying something different, opening up your heart and mind to a different way of being, right? And you could be a very different person in 2 to 4 weeks even.
Mm, So that even behind that, you make videos and you are just so present on the scene, and that's being a leader. That's a patient leader in my book. Like, please unpack how you show up for people and why you show up for people with such fervor and dedication. And what are some things that you kind of had to overcome, some fears that you had to sort of walk past and get over yourself and get out of your own way in order to develop and let true medicine MS blossom?
Yeah. So I actually have very little MS symptoms at this point. I initially couldn't move this arm. This is why I stopped being able to practice anesthesia, couldn't do procedures. But over 7 years of trying, the arm is so much better and I can
Yeah.
run and do all the things I couldn't do before. So I feel gratitude. I feel this debt. I feel that I must push this forward and help other people who are suffering so much from their symptoms, young people, older people. Like it's just such a hard disease to have. And I feel like if I keep doing the good work and putting out what I know, then I can live better knowing that I've helped and supported other people. And, I'm a physician. It's actually my responsibility to do better. As physicians, educating others is actually a part of it. And so I actually take that responsibility very seriously. And when we first started True Medicine, I actually thought I was going to make videos that people were going to watch internally on the website, and then I'd be done because I just wanted to be a doctor, right? And then I realized, oh no, just because you made the videos doesn't mean people are going to come and watch it. You got to get it out there.
Mm.
And I read this amazing book called This is Marketing. It changed my life.
Okay.
And it taught me that if you have created something valuable that is of service to others, it is your job to get it to them. So
100%.
then I thought, well, what does that mean? do I have to do print ads? And they were like, no, you need to get on social media. And I'm like, no, no, no. I don't even know how to check Facebook. Like, I don't even know. And they were like, yes, you will do it. And so I actually have a wonderful team who does all the techie stuff because I was never able to figure out on my own. But I had to get over my shyness, my introversion. I'm an extreme introvert. People can never tell because I'm such a good, actress. But
Well, I can tell because I deal with people all day, every day, and then am an extreme extrovert. So I look at you and I'm like, "Ooh, you was doing a lot of work, Dr. Susan. I respect to you because this is not in your nature, girl."
No, and I'm very private. Like I never post anything on social media about my family. And now look at me.
Yeah.
But it's okay. I've had to give up some of my anonymity and I've had to put myself out there, but it's important. It's like it is the thing I think about 24/7. And it is my life's goal to change how we treat MS. I want to add new tools to the toolkit.
One of the last things, what are some sort of big jumps or shifts that you've seen? Like someone who was like, sure, I'll try this and whatever, and then has a different outcome. Or someone who's like, oh man, I finally found myself here. Great. I'm going to do everything you say 110, 12%. And they jump over the moon with their outcomes. Like, is anything like that in your brain?
I'm having a hard time picking one or two because I see it all the time. And it is really the best part of my job to see somebody click, that everything kind of clicks for them and go, oh, I get it. Okay, I'm on board. And then you ask them to like eat one vegetable and they go, I'm going to eat 10.
I'm gonna eat all the vegetables.
So, one of the times we ran the program, this woman was really, really motivated. Her symptom scores were like in the 200s, and anything under, maybe over 50 or 70 would be high. So she's up in the 200s. In 12 weeks, I think her score came down under 100. She lost a bunch of weight. Mood was better. Pain was better. And I mean, like the numbers were so dramatic. I had to go there and by hand calculate it to make sure I didn't mess up, in the algorithm. So, that happens. I've seen people who say they can't walk. I also do a 12-day MS detox. It's a short, quick reboot. It's all food-based. We don't do anything extreme here. I want to make sure everything's safe. But in 12 days, this woman said, oh, I'm actually walking worse now. And I said, stay with it. Let's see what happens. By the end of the 12 days, she was like, I'm dramatically better. Now, this is just—
I ran over here, Dr. Susan.
Or people will say, I decided to try for 2 weeks to sleep more, just an extra hour, and but go to bed by 11 o'clock, instead of like my 10 o'clock, time that I want everybody to go to bed.
Sure.
Then they wake up and they go, my brain works better. My emotions are better. I'm not grumpy. My anxiety's better. So, did I give that person an SSRI or an anxiety? No, they just changed the way they do things. And so much of modern life is contrary to what we need to be doing to improve our MS health. So we just have to recognize it and start putting little things back into place.
Dr. Susan, where can we find you? Where can we find True Medicine MS, please?
You can go to our website, truemedicinems.com. You can find me on Instagram, on Facebook, and even on YouTube now. So True Medicine MS is our social media handle.
Lovely. No, thank you for coming into this space and sharing some of what makes you so wonderful with the MS Views and News audience. And it's just incredible. I'm looking off to the side to think of words, but it's like, no, man, what she does and what anybody in this space does is wonderful. And it really helps change people's experience with the medical condition, because they are leaders. They are patient leaders. And first and foremost, they're patients. So we get it, but also we're leaders, and we know what it means to be out in front. We know the work it takes to be out in front, and we're here for that. And we're enthusiastic about that. So I know, really, thank you for coming into the space, Doc. And thank you guys for watching. And we'll see you on another MS Views Now.
Thank you. It was my pleasure.